Assalamu alaikum wa rahmatullahi wa barakatuh. This is Dr. Zaid. Today I'll be speaking about T lymphocytes, B lymphocytes, and natural killer cells. The objectives are to know about anatomic physical barriers, innate and acquired immunity, and to know B and T cell development in fetal life and postnatally, and to know some information about immunoglobulins, and to know that it is possible to diagnose some immune deficiencies intrauterine. So what are the anatomic physical barriers? The skin, mucous membranes, mucous blanket, and ciliated epithelial cells. The immune system of vertebrates integrates two fundamental response mechanisms. There is innate immunity or natural immunity, and there is acquired or adaptive immunity. In the innate immunity, it is responding to infection regardless of previous exposure to the agent, and includes polymorphonuclear leukocytes, dendritic and mononuclear phagocytic cells, and also the complement system. The acquired immunity or the adaptive immunity, it is a highly specific response that includes T, B lymphocytes, natural killer cells. And the immune system also helps protect against malignancy and autoimmunity. So T cell and B cell fetal development. The primitive thymic rudiment is formed from the ectoderm of the third branchial cleft and endoderm of the third branchial pouch at 4-week gestation. B cell development begins in the fetal liver. Now I'll speak about some information about immunoglobulins. Because there are at the end of this presentation there are questions, and the information written here is important. IgM is confined primarily to the intravascular compartment because of its large size, whereas IgG is present in all internal body fluids. Second point, IgA is major protective immunoglobulin of external secretions in GI, respiratory, urogenital tracts, but it is also present in the circulation. IgE present in both internal and external body fluids and has a major role in host defense against parasites. This is an important information. This is for the IgE. A human fetus begins to receive significant quantities of maternal IgG through placenta at around 12 weeks of gestation. Maternal IgG gradually disappears during first 6 to 8 months of life, while the rate of infant IgG synthesis increases until adult concentration of total IgG are reached and maintained by 7 to 8 years of age. Postnatally, newborn infants have increased susceptibility to infections with gram-negative organisms because IgM antibodies do not cross the placenta. Neonates begin to synthesize antibodies of IgM class at an increased rate very soon after birth in response to the immense antigenic stimulation of their new environment. This is important now. Serum IgA is normally detected at around 13 days of postnatal life, yani almost 2 weeks. The level gradually increases during early childhood until adult levels are achieved by 6 to 7 years of age. Normal infants cannot usually produce antibodies to polysaccharide antigens until after 2 years of age. However, unless the polysaccharide is conjugated to protein carrier, that's why we are giving vaccines. These are such as conjugate Haemophilus influenza type B, Streptococcus pneumonia vaccines. Prenatal and career detection. Diagnosis of several X-linked defects can be established by direct mutation analysis of X chromosome of cells obtained by chorionic villus sampling or by amniocentesis from male infants whose mothers have been identified as carriers. Thank you for watching this. Now we will move to the questions part. First question. 1-year-old boy has T cell defect immune deficiency. His complete blood count most likely shows A. Neutropenia, neutrophilia, lymphopenia, eosinophilia, monocytosis. Of course, the answer is C. Lymphopenia is seen in the majority of T cell defects. Next. Which of the following immunoglobulin isotype has a major role in host defense against parasites? We said that before during the lecture or the video. The answer is D, IgE. Also the principal mediator of allergic reactions of the immediate type because of high affinity IgE receptors on basophils and mast cells. Next, a medical student asks you about postnatal immunoglobulin development. The statement that should be included in this discussion is: serum IgM rises sharply at about 6 months after birth. Serum IgM reaches adult levels by approximately 6 years of age. Serum IgA remains low throughout infancy. Maternal serum IgG disappears after first year of life. Total IgG are reached and maintained by 1 year of age. So here the answer is C. Serum IgA remains low throughout infancy. Neonates begin to synthesize IgM at an increased rate soon after birth. At about 6 days after birth, the serum concentration of IgM rises sharply. This rise continues until adult levels are achieved by approximately 1 year of age. Serum IgA remains low throughout infancy. Maternal serum IgG gradually disappears during the first 6 to 8 months of life until adult concentrations of total IgG are reached and maintained by 7 to 8 years. The serum IgG level in infants usually reaches a low point at about 3 to 4 months of postnatal life. The rate of development of IgE generally follows that of IgE. So next, a 4-year-old boy has recurrent attacks of gastroenteritis caused by a parasite called Giardia lamblia. Which of the following diseases should be suspected in this boy? Common variable immune deficiency, hyper IgM syndrome, proton gamma globulinemia, selective IgA deficiency, transient hypogammaglobulinemia of infancy. So the answer here is D, selective IgA deficiency. Patients may be asymptomatic or may develop sinopulmonary or gastrointestinal infections, especially Giardia. Next, which immunoglobulin taking the longest time to reach normal adult values? I think we answered this before. The answer is A. IgA takes the longest time to reach normal adult values. Next, the immune system of the human body is composed of different components. Which one of the following statements is true? Complement proteins are parts of the adaptive immune system. The adaptive immune system is composed of B and T lymphocytes. Natural killer cells are important components of the mucociliary anatomic barrier. The innate immune system is composed of phagocytes and T lymphocytes. Of course, here the answer is B. The adaptive immune system is composed of B and T lymphocytes. Next, which of the following is not a part of anatomic barrier immune system? Skin, cilia, phagocytic cells, mucous membrane. Of course, the answer here is C. Okay, so by now we have finished. I hope you benefited from this video, and these are my references. Thank you very much.